relax, and settle down while we take a deep plunge into medical errors that changed people's lives. What if the person you trust with your life makes a catastrophic mistake? Today, we're uncovering 5 shocking medical errors that actually happened, leading to dire consequences for both patients and the professionals involved. These aren't just hypotheticals, they're real stories from public records. First, imagine going in for a routine procedure on your right leg, only to wake up and find the surgeon operated on your left. This is a classic case of wrong site surgery. In one documented incident, a surgeon mixed up patient charts and performed a complex operation on the wrong limb. The mistake was only discovered hours later. The fallout was immense, leading to a massive lawsuit and the immediate suspension of the surgeon's license. This type of error, though rare, highlights the critical importance of pre-surgical checklists and double-checking patient identity. It's a terrifying reminder that even a simple mix-up can have lifelong consequences. Next, we have a case of medication error that went horribly wrong in the pharmacy. A pharmacist, overwhelmed during a busy shift, dispensed a powerful blood thinner instead of a common acid reflux medication. The 2 drugs had similar-looking names, and the pharmacist failed to verify the prescription properly. The patient, an elderly man, took the incorrect medication for several days, leading to a severe internal bleeding event that required emergency hospitalization. The investigation revealed a systemic failure in the pharmacy's verification process. The pharmacist faced disciplinary action and lost their license to practice, a stark warning about the life or death responsibility that comes with dispensing medication. Our third story involves a diagnostic error with devastating results. A young woman repeatedly visited her doctor with persistent fatigue and unusual moles. Her concerns were dismissed as simple stress and benign skin spots. Months later, she was diagnosed by another specialist with advanced stage melanoma that had spread throughout her body. It was too late for effective treatment. Public records from the medical board review showed that the initial doctor failed to order a simple biopsy, a standard procedure for such symptoms. The doctor's license was stripped for gross negligence, but for the patient and her family, the damage was irreversible. This case underscores the importance of advocating for your own health and seeking a second opinion if you feel your concerns are not being heard. Fourth, consider the tragic case of an anesthesia overdose during what should have been a minor surgery. The anesthesiologist miscalculated the dosage of a powerful sedative for a pediatric patient. The child's small body couldn't handle the overwhelming dose, leading to cardiac arrest on the operating table. Despite frantic efforts to revive the child, the damage was done. The subsequent investigation, detailed in public reports, pointed to a clear mathematical error and a failure to use modern monitoring equipment that could have alerted the team sooner. The anesthesiologist was not only stripped of their medical license, but also faced criminal charges for their fatal mistake. Finally, we have the horrifying case of a retained surgical instrument. During a lengthy and complicated abdominal surgery, a surgical sponge was accidentally left inside the patient's body. For months, the patient suffered from chronic pain, infections, and unexplainable fevers. Countless follow-up visits failed to identify the source of the problem. It was only after an unrelated CT scan that the foreign object was discovered. The patient had to undergo another high-risk surgery to remove the sponge and repair the internal damage it had caused. The surgeon and the hospital faced severe penalties for this never event. A mistake so serious it should never happen. It led to a complete overhaul of surgical counting procedures in that institution. These stories are a sobering look at the human side of medicine, where errors can have the gravest of consequences. Thank you for watching. If you found this video informative, please give it a thumbs up, subscribe to our channel, and hit the notification bell so you don't miss our next deep dive. Stay safe and stay informed.